The minimum interval between two doses of tetanus toxoid vaccine to antenatal mother should be A. 1 month, B. 2 month, C. 3 month, D. 4 month. And the correct answer is A. 1 month. During antenatal care, two doses of TT vaccines are given to pregnant women, which is known as TT1 and TT2. First, TT1 vaccine is given, then after at least 1 month after of TT1 vaccine, TT2 vaccine is administered. TT vaccine is always administered intramuscularly and it is given 0.5 ml and at deltoid muscles. TT1 vaccine prevents mother by producing IgM immunoglobulin and TT2 vaccine prevents child by producing IgG immunoglobulin. Remember, both TT1 and TT2 vaccines are given to pregnant women only during antenatal care. Here IgM immunoglobulin cannot cross the placenta, but IgG immunoglobulin can cross the placenta and it is required to protect child against tetanus neonatum. Tetanus neonatum, also known as 8th day disease. The level of care in which care is generally provided in district hospital and community center is known as A. Primordial level, B. Primary level, C. Secondary level, D. Tertiary level. And the correct answer is C. Secondary level. First level of care is primary health care, that is PSC, in which community health center, primary health center and sub-center comes. Second level is secondary health care, in which district hospital comes, and if asking about tertiary level care, in which super specialty medical institute comes, for example AIMS. At some situations CHC counted at both primary and secondary levels. If asking about first referral unit, that is CHC. The most common cause of infant mortality rate in India is A. Low birth weight, B. Complications of labor, C. Sepsis, D. Congenital anomalies. And the correct answer is A. Low birth weight. If asking about most common cause of infants mortality, the best answer is always prematurity. Premature baby will be also preterm baby and low birth weight baby also. So within this concept the correct answer is low birth weight. But secondary cause of infants mortality is respiratory infection, that is pneumonia. If asking about most common cause of mortality in children age group of 1 to 5 years, then answer will be diarrhea, which is caused by rotavirus. Which is not a vector-borne disease? A. Filaria, B. Dengue, C. COVID-19, D. Kala Azar. And the correct answer is C. COVID-19. Diseases which are spread by flies or mosquitoes called vector-borne disease. Examples are like filaria, dengue, Kala Azar, malaria, yellow fever, etc. But COVID-19 is related to virus and it is not vector-borne disease. How many autosomes are there in humans? A. 22 pairs, B. 44 pairs, C. 32 pairs, D. 42 pairs. And the correct answer is A. 22 pairs. There are two types of chromosome found in the normal human cells, autosome and allosome. One human cell has 22 pair of autosome and one pair of allosomes. But two different allosomes are present in different genders. XX allosome found in female and XY allosome found in the male. One of the major complications due to mumps in the young children is A. Weakness, B. Sterility, C. Earaches, D. Meningitis. And the correct answer is D. Meningitis. The most common complication of mumps in the young age children is aseptic meningitis, but in adolescent age, the orchitis and ophritis are major complications. Ophritis is an inflammation of ovaries. Orchitis is an inflammation of testicles. What is the full form of ELISA? A. Enzyme licensed immune solution activity. B. Enzymes linked immune sorbent assay. C. Enzymes linked integrated solution activity. D. Enzymes lysis immune solution assay. And the correct answer is B. Enzymes linked immune sorbent assay. ELISA is used for screening test for HIV, but confirmatory test for HIV is Western blot test. The name of malaria parasites is A. Plasmodium, B. E. coli, C. Amoeba, D. Euglena. And the correct answer is A. Plasmodium. The name of malaria parasite is Plasmodium. There are four most common types: Plasmodium falciparum, Plasmodium vivax, Plasmodium ovale, and Plasmodium knowlesi. Plasmodium falciparum is most dangerous malaria and it is known as cerebral malaria. E. coli, which is a bacteria, and it causes urinary tract infection, most commonly in females due to short urethra in females. An infant's intestines are sterile at birth, thus lacking the bacteria necessary for the synthesis of A. Albumin, B. Bile salts, C. Prothrombin, D. Intrinsic factors. And the correct answer is C. Prothrombin. Vitamin K is taken orally through diet in K1 form. This K1 is converted into K2 form by intestinal flora, which is known as absorbable vitamin K. This K2 activates clotting factor 2nd, 7th, 9th and 10th. The clotting factor number 2nd, that is prothrombin, is converted into thrombin by K2. Fibrinogen converts into fibrin by thrombin. This fibrin creates clotting action now. Which of the following human disease caused by bacteria? A. Hepatitis A, B. Typhoid, C. Measles, D. Polio. And the correct answer is B. Typhoid. Typhoid is a bacterial disease which is caused by Salmonella typhi. Typhoid, also known as enteric fever, and its diagnostic test is Vidal test. It occurs with unhealthy food ingestion. Typhoid is diarrheal disease and its stool pattern is pea soup stool. Another stool pattern is rice water stool, which is found in cholera disease. Within how many population is a primary health center established? A. 3000 to 5000, B. 20,000 to 30,000, C. 30,000 to 20,000, D. 2 lakhs. And the correct answer is B. 20,000 to 30,000. Here we can see sub-center. It is established in hilly area at 3,000 population and in plain area at 5,000 population. If asking about primary health center, it is established in hilly area at 20,000 population and in plain area it is established in 30,000 population. If asking about CSC, it is established in hilly area at 80,000 population and in plain area at 1,20,000 population. What other findings suggest a fluid volume deficit? A. Decreased pulse rate, B. A sunken fontanelles, C. Low urine specific gravity, D. Increased blood pressure. And the correct answer is B. A sunken fontanelles. Sunken fontanelles, that means depressed fontanelles found in child with fluid volume deficit problem, and this is sign of dehydration. If fluid volume deficit present in the patient, there will be hypovolemia and it cause tachycardia and hypotension. There will be concentrated urine with fluid volume deficit, so urine specific gravity will be high. That's why option B is the correct answer. A term where a neonate has thick white cheesy coating on skin, which correctly describe these findings. A. Lanugo. B. Milia. C. Nevus flammus. D. Vernix. And the correct answer is D. Vernix. Vernix caseosa is thick white cheesy coating on skin. Lanugo are fine and downy hairs which are decreased with maturity. Milia is white pinpoints found facial area due to sebaceous gland secretions. Nevus flammus is reddish discoloration of a part of skin. The goal of the National Health Policy 2002 includes A. Eliminating polio by 2005. B. Bringing HIV growth to zero by 2007. C. MMR reduced to 100 by 2010. D. All of above. And the correct answer is D. All of above. Which of the following is not a sexually transmitted disease? A. Chlamydia. B. Gonorrhea. C. Typhus. D. Hepatitis B. And the correct answer is C. Typhus.